copies of the B-globin gene. Some suffer greatly from painful sickling episodes that cause repeated frequent hospitalization, while others experience for consequences from the disorder. Screening for HPSS using IEF comes with several unintended consequences because of the qualitative nature of the test. Babies with hemoglobin variants other than the sickle mutation and both alpha and beta are identified. Another unavoidable consequence of using IEF is the identification of unaffected carriers of a sickle cell and other variants benign condition. Friends, only in rare instances are carriers of the sickle mutation and other variant hemoglobin affected clinically, although studies have shown that this concept can be difficult for families to understand. Abnormal hemoglobin detection, including carrier status, is generally reported to the baby's primary care provider. Access to services for affected individuals continues to be a challenge in some places. Now, treatment methodology. Doctors can provide treatments. I was going through all the literature. What is the professionally accepted treatment? Doctors can provide treatment that help prevent complication from the disease through folic acid, a vitamin that helps the body produce new red blood cell, is often presented for teams with sickle cell anemia. Pain medication helps relieve the symptoms of the crisis. Any kids and teens who have sickle cell diseases should take penicillin or other antibiotics to help prevent infection. Drinking lot of fluids and avoiding extreme cold or heat can help prevent crisis. Some crises can be managed at home with pain medications, rest and extra fluids. But if a crisis is especially intense, a teen may need to go to the hospital for intravenous fluids and stronger pain medication. Many teens with sickle cell anemia occasionally need to get transfusions of healthy red blood cells to help carry oxygen. A few many need transfusion regularly. Scientists are constantly researching ways to help people with sickle cell anemia. Friends, with this situation, how to treat the sickling. As per one of the study, the approaches to inhibit intravascular sickling may be broadly divided into those inhibiting the gelation of HPSS that occurs, those modifying the membrane rendering it less prone to sickling, and those improving peripheral perfusion. Thus, several covalent and non-covalent inhibitors of sickling have been derived from the basic chemical principles. Other agents fail to cross the red cell membrane, but their success in inhibiting gelation of HPSS solution may be lead to a search for similar agent with greater clinical application. A successful anti-sickling agent must be capable of being administered, especially preferably orally, with predictable absorption. It must enter the red cell and react with the hemoglobin or the membrane in such a way that sickling is prevented, but without seriously compromising the structure or function of the red cell and without causing remote toxic effects. It is also preferable if the inhibition sickling is not followed by a secondary hematological effect such as increase in oxygen affinity or increased hemolysis, which tend to negate the advantages by inhibition. These are precise requirements. Few agents listed below have come close to satisfying them. Friends, in conclusion, I was searching for information in cure of sickle cell trait and sickle cell disease from many of the books and also technical medical analytical studies and discussed with many experts. The amount of information on prevention and diagnosis of the disease are overwhelming and lost for 100 years. Of course, one of the latest review paper of Graham, Professor Graham, R. Sargent from Jamaica, who is with us, I have met him yesterday when I was traveling from Delhi to Raipur. He has given full information on disease pattern, and what impressed me is about the thoughts on cure, a use of pneumococcal and importance of teaching splenic palpitation in reducing the mortality from the acute splenic sequestration, use of hydroxycarbamide in preventing painful crisis, bone marrow transplantation. These are the suggestion comes out of the reports. When I refer the recent studies about a multi-genetic perspective of a single gene disorder, the development of a high throughput genotyping methods, the microarray technology, and the completion of the Human Genome Project have already begun to revolutionize the medicine and biology. The application of these techniques to the study of SCD is in its way early stages and likely to yield novel informations. A candidate gene approach and study of genome-wide and other association with certain complication of SCD is expected to further clarify the basis of clinical heterogeneity of the single gene or disorder. The possible course of treatment seems to be correcting the defective gene and insert it into the bone marrow, turning off the defective gene and simultaneously reactivate another gene that turns on production of a fetal hemoglobin. When there is no cure for sickle cell anemia now at this time, in the past 3 decades, the life expectancy of the people with sickle cell anemia has increased. It seems many patients with sickle cell anemia now live in their mid-40s and beyond. Ultimately, a sickle cell disease prevention route is followed rather than complete cure as of today. I suggest to the scientists and medical experts and leaders of sickle cell diseases to form into 5 task teams. In Raipur, today itself, the task team are only to address the treatment and cure of sickle cell disease and sickle cell diseases, taking into reveal diagnosis and prevention, which is already in vogue. Of course, since efforts are on prevention of malaria and HIV through vaccine, a research group has to be formed from various parts of the country for prevention of sickle cell disease. Certainly, the advances in nanomedicine, stem cell therapy, gene therapy and repair, genetical modification, pharmacogenomics, and associated clinical studies may give promising results in the years to come. I greet the organizers of this 4th International Sickle Cell Congress, participants, and the researchers who came from different parts of the world and from various parts of the country, success in their mission of finding cure for sickle cell anemia. May God bless you all, friends. What, madam?
Thank you very much, sir. And I quote from your book, Wings of Fire.
Can I answer the question? Okay. Yes, madam, you can ask the question.
ताकि वो कुछ पौष्टिक आहार खा सके, कुछ पौष्टिक चीजें ले सके, दवाइयां खा सके.
Well, I can appreciate your thoughts. That means some nutrients, what we need. Our patients sometimes the right type of food they don't take. Whether their nutrition value can be augmented. And definitely the project what our Chief Minister has announced may have a component there. I hope so.
Thank you, sir.